My free T3 levels are good, but I still don't feel good. Why is that? I'm still tired. I'm still cold. My hair's coming out. I feel like I'm gaining weight. Well, just know that because your free T3 levels in your bloodstream are normal or okay, does not necessarily mean that that free T3 is going into your cell and actually allowing your cell to work. It tells us that you have the free T3 available in your bloodstream. But remember that hormones, like thyroid hormone, have to be taken into a cell through a receptor in order to actually work. So free T3 will set on a receptor of a cell. And in order for that cell to take that free T3 in, there are things that are needed to help take the free T3 into the cell. They're called cofactors. Some of those with free T3 include ferritin. Iodine is needed to actually make the free T3 hormone molecule. Vitamin D and B12 are also important in this process. So if you are somebody with hypothyroidism and your free T3 levels are adequate, but you still don't feel well, then maybe you should be asking or thinking your provider about, what is my iodine level? What is my ferritin level? There are many women out there with hypothyroidism walking around with low ferritin levels because we menstruate. And when you bleed and you menstruate, you're more likely to have depleted ferritin stores. It doesn't mean you're anemic. You can have a normal blood count, but your ferritin can be low. And when your ferritin is less than 70, it's difficult for your free T3 to enter a cell and to actually work. So if you're somebody who's struggling with this, what is your vitamin D level? It should be above 60 in my opinion. What is your B12 level? It should be above 650. Make sure your folic acid level is good. A lot of patients with hypothyroidism have MTHFR. You have to fix that. It's important. Make sure your iodine level is good. Make sure your ferritin is good. So these are can do if you feel like your thyroid labs are where they need to be, but you're still not feeling well. Then advocate for yourself and ask your provider, can we check these things? Can we make sure these things are okay? So just some more tips on if you think that your thyroid may not be functioning to the best of its ability based on the symptoms that you're having, because feelings matter despite what people tell you. So be your own advocate and make sure that you know these numbers. That would be my advice. And then talk to your provider about how we can make this better. If you like this information, make sure that you're following, that you're subscribing, that you're liking this content. Comment and tell me what you think. Please share it with other people. My goal is to help educate everyone out there about healthcare and about thyroid disorder and help people feel the best that they possibly can.